guys, welcome back to my YouTube channel. If you're new here, my name is Favor and I'm so excited to have you here. Today I've just come in to talk about smear testing. Okay, like I promised in my previous video when I was talking about HPV and cervical cancer, I said I would talk about smear testing in my next video. Okay, so what is smear testing? Smear testing is the same thing as cervical screening. It's a test done to assess the health of your cervix. Okay, smear testing is not a test for cancer. Okay, it's just a test to assess the cervix and see how healthy it looks, whether there's any abnormality, any abnormal cells or abnormal changes, and tackle it on time before it progresses to cancer. Smear testing is recommended for women between the ages of 25 to 64 years, like I said in my previous video, but some countries have started testing females even as young as 21 years old. Okay, so this test is done every 3 years. Okay, it's done at a 3 years interval where a sample is collected from your cervix and tested for high risk type of HPV. Okay, this high risk type of HPV are the ones that causes changes to your cervix, okay, or the cells of your cervix. So when this test is done and it is normal, usually you're being discharged home to come back again after 3 years. But when it's done and there is any abnormality detected, you're usually referred for procedures such as colposcopy, where biopsy is taken and tested just to ascertain the level of the change, whether it's low grade, whether it's moderate or is high grade. Okay, if it's low grade, usually they send you back and ask you to come back after a year to run another test to see if your body has cleared it naturally. Like I told you before, your body will clear the virus naturally, or sometimes they can cause other complications. All right, example cervical cancer. So when you come back after a year, they will know if your body has actually cleared it or it's still progressing. Okay, but if it's something like a high risk one that is detected, they will start treatment immediately. All right, depending on what is detected after the biopsy. Okay, I'll quickly talk about what to expect when you're going in for this procedure. First things first, you have to book your appointment with your GP, or you speak to your doctor to book an appointment. And before you book this appointment, just select a date where you won't be menstruating. Okay, because if you're in your menstrual period and you're bleeding, it will be difficult to collect the sample. Usually we will send you back and we schedule for a later date. All right, we won't be able to collect the sample if you're on your period. So if you're selecting a date for your appointment, select a date where you're not on your period. All right. Another thing is, a few days before your appointment, you have to avoid sexual intercourse, right? You have to avoid using any suppositories. You have to avoid using any vaginal wash, V-wash, or anything down there. Just wash with plain water. Okay. This is simply because when you use some of these things, they might tend to wash off the abnormal cells, and when we take the samples, the result comes out inaccurate. Okay, so we don't see anything. We tell you it's normal when actually it might not be normal. So you don't use this thing so that we will be accurate with our findings, right? And on the day of your appointment, I usually advise people to put on things that are very easy for them to remove, like a skirt, a gown, or short, or something that is very easy for you to remove, because it will require you to remove all your clothing from your waist below. All right, and we'll give you a cloth to cover up and meet us on the table. But if you wear something difficult, it's your time you're wasting. This procedure shouldn't take you more than 10 to 15 minutes, but the more time you waste, the more time you spend there. Okay, once your details have been verified and you've taken off your clothing and you just have the clothes and you're on the table, just watch this video. This is exactly what happens.
An instrument called a speculum will be inserted into your vagina and used to open the walls of the vagina so that your cervix can be seen. A soft brush is then inserted through the speculum onto your cervix. The brush will be rotated a few times to collect the sample. The brush will then be washed in a specimen pot, and the pot will be sent to the lab for processing.
So this is exactly what happens. This is smear testing. As you can see, it didn't even take any time. As long as you're on that table and you do as instructed, it won't even take any time. But I would suggest one thing. If you're going in for this procedure and you get there, speak to the nurse taking the sample for you. Okay, ask them to use a smaller sized speculum. Okay, especially if you're very tight down there, request for a smaller size speculum. And if they're not able to assess your cervix using that, they can progress to a bigger size and bigger size and bigger size. All right, because most people, when get into their clinics for a smear test, they just go with the big speculum, so it will be easy for them to just assess your cervix, not even considering whether you will be in pain, whether you're tied down there. So is your right, when you get there, speak to them, tell them, I want a smaller size speculum. I'm tied down there, I want a smaller size speculum. Okay, usually they lubricate the speculum so it to be easy to go in. Right, so if you don't want to experience more pain, ask for a smaller size speculum. Okay, so that is it about smear testing. It doesn't even take time, and I encourage you as a woman, right? Even as a man, encourage your sisters, encourage your mother, encourage your siblings, encourage your friends who are up to 25 years. Even some countries are testing young girls from 21 years. All right, to get this smear testing, it is important. It is very, very important. Help us catch these things early. Help us reduce the rate of cervical cancer. All right, it's absolutely necessary. I encourage you, I implore you, all right, to get a smear test today. All right, I'll see you in my next video actually, but before I go, please make sure you subscribe to this channel. Please, I'm begging you again. Click on the subscribe button, like this video, share the link to your friends, share the link to anyone you feel that needs to see this video. Until I see you in my next video, take care of yourself, be safe out there. Love you.